Good afternoon, my friends. This is Lawrence Guidry, the old airman, talking to you from the heart of the Ozark Mountains in southwest Missouri. Good afternoon. I hope all my friends are doing good this afternoon. Over here it's been mostly sunny, but kind of a windy, with wind going from different directions, southwest to southeast to south, but it didn't rain, which is good. Today we're going to talk about the vaccine that Johns Hopkins Hospital is trying to come up with. And I don't know if you've heard about it, but here's what they're saying about the vaccine. It says, with a vaccine for COVID-19 still a long way from being realized, Johns Hopkins immunologist Arturo Casadevall is working to revive a century-old blood-derived treatment for the use in the United States in hopes of slowing down the spread of the disease. With the right pieces in place, he says, the treatment could be set up at Johns Hopkins University in Baltimore within a matter of weeks. It also goes on to say, with the right pieces in place, the treatment could be set up at Johns Hopkins University in Baltimore, and I said that before, didn't I? Sorry, folks. The technique uses antibiotics, it goes on to say, from the blood plasma or serum of people who have recovered from COVID-19 infection to boost the immunity of newly infected patients and those at risk of contracting the disease. These antibodies contained in the blood serum have the ability to bind to and neutralize SARS-CoV-2, this virus that causes COVID-19. Casadevall, a Bloomsburg Distinguished Professor of Molecular Microbiology and Immunology, I'm trying to pronounce these words, folks, and infectious diseases at Johns Hopkins University, Johns Hopkins Bloomsburg School of Public Health and School of Medicine. Okay, folks, I'm going to try to see if I can read this a little better for you. Development, let's see what it goes on to say. I lost my place here. Baltimore School of Medicine and the School of Medicine published a paper on the proposals today, that was yesterday, I believe, in the Journal of Clinical Investigation, stating deployment of this option requires no research or development. He says it could be developed within a couple of weeks since it relies on standard blood banking procedures or practices. Johns Hopkins' response to COVID-19. Coverage of how the COVID-19 pandemic is affecting operations at JHU, Johns Hopkins University, and how Hopkins experts and scientists are responding to the outbreak. In this case, physicians would ask patients who recover from COVID-19 to donate their blood, from which sera would be isolated. After processing the serum and removing other toxins or trace of illnesses, it can be injected into the sick patients and those at risk of contracting the disease. The procedure for isolating serum or plasma is a long-established technology that can be performed using equipment normally found in hospitals and blood banking facilities. And recent advances make it as safe as blood transfusion. Experts around the U.S. are rushing to implement the treatment in several different areas, including New York City. Doctors in Shanghai have already used the plasma therapy with newly infected coronavirus patients in China and have reported promising early results. Japan's largest drug maker, Takeda Pharmaceuticals has also begun testing the therapy. Well, it's looking promising, isn't it? I mean, maybe they should come up with one. The Johns Hopkins research team has put initial funding towards Casa Devol's project to purchase equipment and set up an operation in Baltimore. Casa Devol and his team are working now with state and federal officials to try to secure those more resources. Said also, it goes on to say in headlines, deployment of this option requires no research again or development. It could be developed within a couple of weeks since it relies on standard blood banking practices. That's not bad. The medical concept known as convalescent plasma or convalescent serum dates back to the early 20th century and was used successfully in the past to counter epidemics including mumps and measles. Interesting, isn't it? In a recent Wall Street Journal op-ed, should I say, Casa Devol points to a notable cause preventing a disease outbreak in the United States. Prep school in 1934. Experts say a challenge of the technique is that the precise timing is important in order to maximize the blood to a patient's immunity. The treatment is a temporary measure that could help until stronger options such as vaccines are available. It is doable. It is doable. That's good. But to get it done, it requires effort, organization, resources, and people who have recovered from the disease who can donate the blood. Yeah, the blood's important. Casa Devol says, he adds that many have stepped up to the plate at Hopkins and are already working to put this system in place. Well, that's wonderful news, isn't it, my friends? If they can actually use it until they can perfect the serum, the vaccine, then they can prevent other people from getting it, or they get it not as bad as they would ordinarily if they didn't have this infusion. Because a while back, about 3 years ago, I had this infusion to see if it would help my neuropathy, but it hadn't really helped. I had 5 infusions, and but it didn't seem to help me, so I stopped it, folks. All right, folks. Again, this is the occasion. Lawrence Guidry, coming to you from deep in the heart of the Ozark Mountains in southwest Missouri. Have a great afternoon and a better evening, folks. A great week coming up, and may God bless. Goodbye.